Hello, I am a nurse in the urology clinic and I'm going to show you how to prepare an injection called Leuprolide or Eligard. Eligard is a medication given to men for late stage prostate cancers. It's a medication that has to be administered within 30 minutes of being taken out of the refrigerator, so this will be in your MedSelect refrigerators. Be sure to verify your orders. There's two different doses on Eligard. Eligard 45 milligrams, which is given most often, is administered every 6 months. There's a longer one that's given every 3 months, but typically you'll be giving the 6-month injection to these men. In preparation, be sure you've performed appropriate hand hygiene, and you must always wear gloves. The type of medication this is considered a chemo drug, so you do not want to touch it or handle it with bare hands. You will note there is a syringe A and a syringe B, 1 of 2 and 2 of 2. They both will have separate lot numbers. This is important when in your documentation. You'll still be doing an outpatient injection note, is the name title. The kit will come with the syringe, subcutaneous syringe. It's an 18 gauge 5/8 syringe. Alcohol swab is not included. You will need a separate alcohol swab. Set that out. This is syringe B. It is longer and wide. Has a rubber stopper on top. This blue plug will come out. I'll show you that in just a second. The other tray has the liquid. If you note in syringe B, there's a powder here. This is a gel. These get mixed together to form the concentrate, and then a plunger, which will be applied to this one. So we're going to start. You can see this rubber plug and the blue cap pulls out. Be sure that plug comes with it. And here you will note there's a rubber plug at the top. There is a threading on it, which matches up to the threading on this end of the syringe. This goes in, half turn, just like any other IV port. With that, I'm going to take this this plastic cap off of syringe A. Being careful not to depress here, as well as the plug on B. You want to keep the powder upright. Screw these on. It's about a half a turn, and you will get something that looks like this. And for mixing, you're just going to simply push back and forth. You can see the powder starting to dissolve. The consistency of this when it's completely mixed and diluted is about that of toothpaste. Sometimes I'll press extra hard on this end to get some of that around the rim of that, just to be sure all that powder is diluted. And you'll know it's completely diluted when you don't see any more of the hard white powder. It'll all look like toothpaste. So one of the big things with administering this is also it can only be out of the refrigerator for 30 minutes. You want to be sure that it comes to room temperature before administering. So you got like a small window to administer this. You never pull it until the patient's here. Typically by the time you get it mixed, it's to room temperature. So the big thing is you got 30 minutes basically from the time this is done. Now the next part is very important so you don't lose any of the medication. Make sure your wider syringe, syringe B, is down facing upright. And you're going to push everything down into it so you get as much air down as you can, because once you release this syringe, the force of that can come up and push the medication out, and you don't want to waste any of it. So while you have this plunger, I get my needle tip ready. Pull it off. Get your syringe on. And just because of the pressure of it, I don't push it all the way up because it has a tendency to force it through the needle, so I wait until I'm about to administer it to the patient before I push all the air. Some amount of air is acceptable in the product according to the manufacturer's instructions. There will also be instructions, detailed instructions in the kit. It's front and back, has very nice pictures. All the drug information on the back side, but this one side will be most of your resource here. It goes over the dosage administration, indications for it, some of the side effects you're going to want to look for. Most people that will be administering it to, they get it routinely every 6 months. If it's their first one, and with any injection, even if on your third one, you can still develop reactions. So just be sure your veteran stays around at least for 20 minutes for observation, just to be sure they're not going to experience any side effects from the medication. I'll provide further, more detailed information on the specifics and the dosage and side effects and things to look for.